Hi, everyone, and thanks for tuning in to another episode of STEM Girls Virtual. My name is Becca, and I'm here on behalf of Cincinnati Museum Center in a series where we talk about all the careers in the STEM fields. Those fields are science, technology, engineering, and math. And today we are with a very special guest. Her name is Dr. Jordan Halsey, and she is a reconstructive surgeon working in craniofacial and pediatric plastic surgery at Nationwide Children's Hospital. Hi, Dr. Halsey, how are you today?
I'm good. How are you?
So good. I'm really excited to learn about this field. This is not a field that we really get to hear about or talk about much. So I'm excited. I'm sure everyone at home is excited. So without further ado, let's go ahead and jump in.
Okay.
Perfect. So the first question we have is, can you tell us a little bit more about your job? Explain to us what it is that you do, and especially the craniofacial part. Explain to us what that is, because I don't think some of us are not aware of what exactly that means.
I totally get that. So craniofacial surgery is a specific field in plastic surgery where we operate mainly on the head and neck. And specifically, my job at Nationwide focuses on children and infants. So to get a better idea of what we do, think about commercials you've seen for Operation Smile or Smile Train. A lot of children with cleft lip and palate require multiple reconstructive surgeries. So craniofacial surgeons are the surgeons that perform those. In addition to other children that have deformities of their head and neck, we also operate on adults. We do sort of plastic and reconstructive surgery all around. But specifically at Nationwide, it's great because you get to operate on children, and it's a really life-changing experience. When babies and children have deformities, a lot of times if they weren't corrected, they would get bullied or have other, kind of social issues. And, really it's a life-changing experience to get to play that role in people's lives. So it's a great field.
That sounds like it. That sounds like such a rewarding career to be in. And so thank you for helping all the people that you help. So our next question is, can you please tell us what sparked your interest in this field? Was this something that you always wanted to do? Was it something that you kind of found yourself growing into? Just tell us a little bit about your journey.
I always wanted to be a doctor. Ever since I was like a little kid, I was like I read medical books. I like wrote my parents' prescriptions with crayons. Like I was that child. And what really kind of expounded that interest was that I went on a few medical missions trips when I was in high school, and it was life-changing. We didn't do any cleft lip or palate surgery, so it's not like I was getting to see that, but I knew at that point I wanted to do something that I could apply to medical missions eventually. So when I got to medical school, I tried out a lot of different fields. It's kind of the educational process. You get to try out a lot of different things. And I remember my first day on plastic surgery, we took a person's bone from their leg and used it to reconstruct their jaw. And that for me was just like a game changer. I had never seen anything like that. It was literally the coolest thing. And I knew at that point that that's what I wanted to do. I wanted to be a reconstructive surgeon. And ironically, in craniofacial surgery, we do that same surgery. So I get to do that too. But it's great because now I sort of have the opportunity to do creative things, but I can still apply it to the medical missions.
That is so cool. And that sounds like such a crazy thing to see. I mean, we hear about things like that all the time, but I can't imagine like actually being able to see it and do it. That sounds so cool. So our next experience dives into more cool stuff. Our next question is about your experiences. What is the coolest experience that you have had as part of your career?
I have to say, I mean, we've done a lot of really cool surgeries. We do a lot of, moving parts, moving part of your thigh to make your tongue, moving part of your arm to make your tongue, like crazy stuff that we can do in reconstructive surgery. But I have to say the craziest experience I've got to have, or really the most meaningful both, was that I got to go on a medical missions trip just recently at the end of 2018 to the Amazon. And we went to remote villages and literally places where I don't think a lot of Americans had even ever been before. And so I got to actually be a plastic surgeon in the wild. And let me tell you, it's a different world. It's way different than, when you have all the resources in the operating room at home, when you're kind of correcting deformities or wounds or whatever you encounter. It's crazy. But it really hit home for me because, like I said, I'd always known that medical missions was a part of what I wanted to do. And so finally being that surgeon and getting to do that firsthand was a really meaningful experience.
Oh, wow. That sounds like such a cool experience. Wow, that sounds so cool, so unique. There's so many parts of that. Even just being in the Amazon alone, whether or not you were doing surgeries or anything like that, that alone is so cool. So thank you for sharing that with us.
Oh,
So
yeah.
our next question is, what is a challenge that you faced on your journey and how did you overcome it? Sometimes it helps others to learn how to overcome their personal challenges by learning how somebody else overcame one of their personal challenges. So we would just love to learn a bit from you.
I think the biggest thing I will say for any females, especially seeking a career in medicine and surgery, a lot of times you get a feeling of almost like an imposter, like you're like in a man's world. There's a lot of, traditionally surgery was all boys. It was a boys club. It has changed. The world is definitely going in a more even direction now, which is wonderful. But even on my journey, I definitely felt like, I'm being the kind of bubbly personality. People sort of thought I should go into like OBGYN or I should go into pediatrician. And those are wonderful, like pediatrics, all of it. Every medical field is great. And I have nothing negative to say about that. But for me, I shouldn't not be able to be a surgeon because I'm bubbly. I think that that's just not appropriate. So when I first rotated on plastic surgery, I met two specific females who were already plastic surgeons, and they were phenomenal mentors to me. And I think that that was the game changer. It was what really validated the fact that like I could be in this world. I can do this because these two girls did it already. And they sort of paved the way for me. And it's great because I think that it gave me the confidence to really feel like I can pursue this, I can be a leader in this field, and I don't have to be a man to do it. And so, I think there are fabulous male mentors who will support women. I think that, mentorship is invaluable no matter who it comes from. But I will say, meeting those two women changed my life. And I hope that, for anybody seeking any sort of field in surgery in particular, that you can find a good, strong female person to look up to.
I think that's fantastic advice. Any mentor, find a mentor,
Yep.
ask them questions, look up to them, learn from them.
Yeah.
Just as we are learning from your experiences, you can find a mentor and learn from their experiences. And that is fantastic advice to receive and to act upon. So we encourage that. Find a mentor and keep pushing. So the next question is, what is some advice you'd like to give to any young person wanting to pursue a career in a STEM field? So you've already touched on finding a mentor. Do you have any other advice you'd like to impart on our young crowd?
I definitely think, once you kind of have an idea, and it doesn't even have to be what you end up doing, but just ideas of things you're interested in, I think you should seek out some sort of opportunity to get involved in that, even if it's in small ways. A lot of times there are opportunities to volunteer at hospitals, even before you're, in medical school, or, you don't even have to have any sort of degree or anything. They will gladly accept people to volunteer and help out. And I did that when I was in college before I even graduated, before I went to medical school. And it was such a very, life-changing experience because it validated the fact that I love the hospital. I love talking to patients. It was a great fit for me. And I'm glad I had that experience. It was an OBGYN. It wasn't the field I even ended up going into, but it was a very great, kind of overall experience because it solidified my personal interest. So even if you're young and you don't think that there's a lot, for you to get involved in, seek out those opportunities because they're there. You just have to sort of look them up and ask around.
That is fantastic advice. Definitely always keep asking. Look into your local doctors or any local professional in
Mhm.
the career you think might be for you. It's great to reach out to those folks. Reach out to them. Say
Yeah,
hello. Introduce yourself. See if you might be able to learn from them. There's so many opportunities out there. You just have to go and reach for them and look for them and go for it. You just got to do it. So we
absolutely.
do have one more question. Do you have some time to answer that today?
Yes.
Perfect. So this question is obviously a child or teen cannot go into surgery room.
Mhm.
They can't go into OR and get their hands-on experience. But do you know of any ways that a young person can find out more about a career such as this, to see if it might be for them, what they want to do in the future. You just talked about, finding mentors. You talked about learning from local professionals. Is there anything else that you can advise us on? Maybe there's some kind of virtual experience that our young crowd can do right now in this current day and age, anything that would help them see, oh, is this the path for me? Especially those older teenagers that are really trying to decide what next steps to take.
Um, yeah, it is a little challenging because obviously there's limitations on who can be in the operating room to specifically observe surgeries. But I think there's a few different ways that if you're interested that you can maybe get involved. Definitely shadowing opportunities in physician offices is something, even younger kids and adolescents or teenagers, anybody who's sort of interested. A lot of doctors are okay with having them come around at least for a little bit of time just to, kind of see what the day-to-day is like. What do they normally do? Like, that a lot of times patients are completely okay with that. So I think it's something that you can definitely look into. Meeting, even if you could just meet with the doctors and just talk to them about what they do on a day-to-day basis and get an idea of like what that career looks like. Another fun thing, and this may not be for everybody, but there are a lot of YouTube videos about suturing and suture kits you can get on Amazon where you can practice, and that is super fun. I recommend this for college students, for medical students and people, but even younger kids I think would enjoy, especially teenagers who are interested, who kind of want to see like, is this something I would like? You can practice suturing on bananas and oranges and fun things at home. And I mean, it'll tell you right away whether it's something you really like, and you have to really like it if you want to be a surgeon. We do a lot of suturing, but it's a fun hands-on experience, and it can be, YouTube and the way that, kind of all these resources we have now with media, you really can learn a lot from that. So I think that's a fun way if you're interested.
Yeah, that sounds like a lot of fun. I kind of want to try that out. So thank you for sharing that with us. Dr. Halsey, that is all we have for today. Thank you so much for joining us and telling us all about your amazing career. We really loved learning with you today. Thank you so much. It's been fascinating.
Absolutely. Anytime.
And thank you all for tuning in and watching this episode of STEM Girls Virtual. Keep tuning in for more videos. We have more STEM Girls Virtual, of course. We have vintage beauty tutorials, story tree times, dance parties, all kinds of amazing things coming at you all the time. So keep tuning in and keep learning, Cincinnati. Bye, everyone.